And I'm going to look right inside.
1 in 6 school-aged children have eye problems that will significantly impair their vision. Dr. Linda Kuhn says kids should have their eyes tested at 6 months, 3 years, and annually when they start school.
But that just isn't happening. So we do have kids who are starting school with lazy eyes and eyes that are not both pointed in the same direction.
One in 6 children has a vision-related problem. Find out what your child really sees. Regular visits to the eye doctor are a part of your child's healthy development.
It is, because it's not until children reach the age of about 9 or 10 that they have a sense of awareness of what other people see and can compare it to what they see. So children Emily's age don't have any idea that they're not seeing as well as they could be seeing.
And he went over to his computer.
4-year-old Melissa curls up for a good read, but only 2 months ago these pages were a blur. Melissa's mom was shocked to discover her daughter had serious vision problems.
I had a good little cry, and just because as a parent you felt a little guilty that you hadn't caught that.
Your child might have a vision problem and you wouldn't even know it. Children who can't see very well also don't tend to do well in school. They may be diagnosed as being learning disabled or having a behavioral problem, when in fact all they might need is a pair of glasses.
If a child can't see very well, then they will lose interest in what they're doing because they have to focus so much harder.
Little Josh is going into grade 2. He doesn't have a problem, but it never hurts to be sure.
Dad, let's just take a closer look to your eye if there's anything wrong.
You just want to make sure that your eyes were perfect?
Yes.
And are they perfect?
I think so.
You can't always depend on your child to tell you something is wrong. Some of the symptoms to watch for include red eyes, headaches, inability to sit still, or favoring one eye while watching TV.
A child will assume that everybody else sees the same way as they do, and so they won't tell their parents that they're having problems seeing.
You think little kids should get their eyes checked out by the eye doctor?
Yeah.
I was one of those kids who had bad eyes when I was, and do they get worse if it goes undetected? I mean,
it depends on what the problem is. For example, if there's good vision in one eye and poor vision in the other, amblyopia can be the result, or otherwise known as lazy eye. And the visual system develops so rapidly before the age of 6. It's so much easier to correct a problem such as a lazy eye before the child is 6 years old than if they're 10 or 12.
Well, good advice. You got good eyes.
I think she does.
Give me a high five. There you go. Thanks, Emily.
Vision develops most in children up until the age of 8, so early detection of problems is important. Dr. Catherine Corelli says the eye chart test at the pediatrician only screens for nearsightedness, so it's not enough.
It doesn't evaluate the coordination of the eyes, depth perception. It doesn't evaluate for farsightedness or for astigmatism.
12-year-old Daniel Hadwin was running into tables and sitting very close to the TV at an early age, so his parents took him to get his eyes checked. Getting glasses at age 4 was a relief.
I think they've helped me a lot because my mom says that before I got my glasses, I had no real perception, so I bumped into things.
The eye exam is also modified to consider the unique needs of certain patient groups. For children, more emphasis is placed on checking the development of the child's visual system. Children should have their eyes examined by an optometrist at the age of 6 months, again before they start the kindergarten, and annually thereafter. The optometrist spends more time with younger patients checking their depth perception, color vision, eye tracking, and eye coordination. Parents may not be aware that their child may have eye problems such as lazy eye, which is best managed when caught early. As well, subtle problems such as poor eye coordination can profoundly affect a child's ability to learn, since 80% of learning is visual.